Mark Holland is the Minister of Health, and he joins me now. Minister, welcome back to the show.
Thanks so much for having me.
So you have 1.7 million Canadians who've signed up looking to benefit from this program, but you're having challenges on the other side, getting buy-in from dental care providers. What's your sense of what that gap is now? How many more people do you need to sign up on the dentist side for this program to work?
Well, we just had a great conversation today with all the provincial and territorial dental associations in Toronto. That meeting just happened a few hours ago. It was extremely positive. We're down to a few issues, and I would say, the dental associations and all the dentists and denturists and hygienists I've spoken to are very excited. They want to get every patient covered. They want to see this plan work. It's just about working through some of those details, making sure that the plan works and functions like other plans that they're used to. So we're creating an alternate pathway so that it's simpler and easy to participate. You can do it. You can use it as a one-off. You can use it every time that way. So trying to make it simple so that somebody can walk in, give their card, they can put it into the system, and boom, you're getting service.
Okay, so that seems like a key thing. You say alternate pathway, but the idea of coming in and giving your card, because I know we spoke with Heather Carr, who speaks for the dental associations nationally last week on the show, and she made the point that that dental staff's needing to enroll in the program and figure out how it works and then find a way to harmonize that with the needs of their patients was part of the issue here. So are you changing it more towards the way, say, my insurance works as an employee of the CBC, that I give them my information, they bill it, and they don't have to do anything else? Is that where this is going?
Yeah, exactly. So that you can identify in advance that you want to participate, or you can just have somebody walk in, take the card, put the information into the same system that you use for any other insurance. And if for over 90% of procedures, you're going to get paid inside of 2 days. For procedures that are more complex, where you have a more complex oral health need, then we have pre-authorization that's going to come online in fall. And in that instance, we want to make sure that that we have verification that the procedure needs to be done, but there's no upward limit. As long as it's medically necessary, it will be done. So we've been working with the Dental Association, with Heather and all the other leads, I think very productively. They've raised concerns and issues, and we're trying to adapt and work with them to make it as user-friendly as possible.
Okay, so this one-off option, that seems to ease some of the administrative burden and sign-up concerns that the Dental Association had. Is that your sense of it, that this clears some of that confusion out of the way?
Sure, absolutely. I mean, I really tried to slim down the original participation agreement, but there were still concerns with it. So we said, okay, let's create an alternate model that allows people to just put the information into the system and to bill that way. So I think that alleviates a lot of the concerns. And of course, they want to see that. We're still putting the finishing touches on it, so they've got to see it and kind of test it out. But I'm quite confident when they see that that we're going to be in a very strong place to move forward. We also have a working group that's working on that pre-authorization process when you have more complicated oral health needs, to really make sure that that's simple and clear and fast and easy to use. We just want to make sure that we have verification that procedure needs to be done, but we want people to get that health care. It's so essential, because we know that when people get preventative oral health care, they don't wind up in hospital rooms. They don't wind up having to get unnecessary surgeries. They don't wind up with chronic disease and illness. So it's extremely important as a matter, not just of having people have healthy, happy smiles, but as prevention, to avoid costs and to avoid bad health outcomes.
So I just want to circle back, if I can, to how a dentist's office will participate in this, because this is new information to me that we're learning in real time. So they can still go through the sign-up process that was originally envisioned, though you're going to streamline that to some degree, as you say. And if they don't, this alternate way of the one-off thing will work whether they sign up or not. And that, what was your sense for them that will that help participation in it? Because I know they were worried about not wanting to sign up because of concerns about how the program would work, potentially having to sever the relationship with clients who don't have insurance but would like to use insurance of this because of the confusion. And Heather Carr was saying only about 10 to 15% of dental offices had signed up for this. So, I mean, do you anticipate this will help alleviate some of the concerns of the people who aren't there yet?
Oh, for sure. And, one of the things, David, that we're saying is, look, show your card, rather for the providers, for the dentists, the denturists, and the hygienists, is this, this one-off. You can use it every time that way. You can use it once, see how it works, see how easy it is. and you'll find that it's the same as any other insurance plan you're using. So it is going to be very simple, very easy to use. We're really working hard to make sure that's a streamlined, positive experience. And of course, we only succeed if both patients and dentists are having positive experiences and really participating positively with the program. So we're going to be watching in real time how it's going and continuing to make improvements to the program. And I can tell you, talking to the dental associations today, talking to dentists, hygienists, and denturists, I mean, they've got their whole heart set on their patients. They want to make sure they get good care. And so that's why I'm convinced we're going to get there. And you're going to see very broad participation because we agree at a high level. It's just a function of, making it work as seamlessly and as positively as possible.
But this seems to allow patients to maintain their relationship with their dentist, even if they don't do the official sign up. That was a key thing we'd heard from some patients potentially worried about, if my dental office doesn't sign up for this, I won't be able to maintain this relationship. This seems to allow that relationship to continue unchanged from this new program.
Yeah, that's right. I mean, if you don't want to, as a dental office, sign up, you just want to use it as a one-off and test it out, or if you want to use that portal all the time and never officially sign up, this is going to be your option. And it means that everybody is going to be able to participate. So we're just working through the final details of that, but it's really important that that be there and that we give that choice to providers and how they want to access the program and make it as simple as possible for them.
So one other concern that was expressed that was stopping some dental providers from signing up is how this program, interacts with provincial and territorial programs and how they would work together or potentially compete against each other, creating complication at that end. So have you found a solution to harmonize that, Minister?
Yeah, we're having very positive conversations. They were happening at the same time we were doing these bilateral agreements. So we have all these bilateral agreements on healthcare, taking action on primary care, and really, reducing backlog, making sure there's more doctors and nurses, and improving our health system overall. And at the same time, we were talking about the dental plan and about how we coordinate our two plans so that they are complementary to each other. And we're making really good progress on that. So I'll have more to say in the next number of days. But it's, that's our objective. And there are a couple of jurisdictions that are a little bit different. So I can talk about Quebec. Quebec has said that they want to run the program themselves. They want to be responsible for it. I, of course, have no problem with that. My only condition is that people get service now. So they would use the plan that we have today so that Quebecers have access to that plan right away. And then we can take the time to transition to the province taking it over if they want, as long as they have the same level of care or higher than what we're offering today.
Okay, so you still have some things to work out. This is all supposed to run in May. It's what, April 11th now? What's your target to have everything ironed out so people can start going to the dentist under this program without problem?
Well, this is the largest federal program ever launched. We're talking about a quarter of Canadians, 9 million people who don't have oral health care, and pulling the tarp of health over oral health, which is so important. So it's not going to be without challenges. We always imagined this would be iterative. So we started with the most vulnerable, with our most vulnerable seniors, and then we're moving through the population. This alternate pathway, I said, isn't going to be ready right away. We're going to need a little bit of time, not too long, to get it up and running. And then also pre-authorization isn't ready to the fall. But every person we see, and we have thousands and thousands and thousands of providers across the country who've already signed on to the existing model, they're going to be seeing patients right away. Some of those, many of those seniors who I said 1.7 million have signed up, many of them who are eligible for service in May. So we're going to see thousands and tens of thousands of Canadians who never have had oral health care before, and in many cases, finally getting oral health care. So that's going to be happening in May, and every month, every day, we're going to see more and more patients, more and more capacity brought on, and we're going to add different functionality. But for us, it was important to get that care quickly and then to have it be iterative and roll and improve as we move forward, rather than wait for perfection, because the perfectional, only comes through iterative steps. You can't kind of do all of that behind the curtain. You got to step out and you got to make things work, and that's what we're doing.
But Minister, what's the timeline for the alternate pathway? Because that seems to be the solution to a lot of the concerns and a lot of the problems. Alternate pathway, it's sort of the card system, I guess, is a better way to describe. I don't know, but is that a May target? Is that June? Is it July? Or is that even later than that? When do you think that'll be up and running?
Well, certainly not later than the timelines that you indicated. This is immediate term. We have to work with the provider on sort of the technical capacity, and also we're having conversations with the dental providers to make sure that we get it right and that they're going to be happy with that portal. We need a little bit of time to fine tune that and get that in place. So it's in that kind of timing.
Okay. Health Minister Mark Holland, thanks for your time today.
Thanks so much.